Well, I always wanted to start my own practice, and I had the good fortune of working for UT Health Medical School for my first 5 years out of training. And that, just really gave me a lot of ideas for how I wanted to be able to practice. And there were many things I loved about working at UT, and there were some challenges where I felt like I couldn't be as creative or innovative with taking care of people with skin problems. So I wanted to start the practice so that I would be able to be a little bit more creative, innovative, be able to bring more people into the practice and do more things that would help just provide the very, very best care for people in San Antonio and South Texas. We've certainly been able to help individual patients with their skin conditions. Often we'll help their family members. So early on, we like to say that we were helping to care for multiple generations of Texans. That's still something that we do. I love that, but at the same time, as we've grown to a practice of 100 employees, there's many people that have been able to have great careers here on so many different levels. Many of our employees stay and they grow within one department or they move on to another. We've had medical assistants who've become research assistants. We've had other medical assistants that have gone on to PA school. So it's just exciting to see how we're able to encourage people to be their very best. Well, over the next 10 years, we want to continue to do what we're doing, but make it even better. We want to have better facilities. We're expanding at our Alamo Heights location and at our Brooks Mission Trails location. We're also continuing to expand the clinical research side of the practice and doing more trials, always looking for new doctors who share our vision and new PAs. So we're excited. We're also developing our med spa so that we'll have a bigger facility both at Alamo Heights and at the Dominion practice. And I know that we'll only continue to get the very best treatments for med spa as we move into these next 10 years.
What I think would entice other physicians to join Texas Dermatology is the level of cutting-edge technology in the office. I work for Kendall Medical. This office has multiple devices of ours that are the industry leader for PDLs, for Pico lasers, for Alexandrite and YAG lasers. They've got all this amazing technology in the office that not a lot of offices are going to have that much tech in one place to treat their patients effectively. So in looking at Texas Derm, they've got all the technology and equipment there to let you do your jobs the right way.
So I started working under Dr. Browning 10 years ago. He interviewed me, he hired me, he trained me. When I first started working with him, it was the summer of 2014, and I was his shadow. So for at least 3 months, I was just watching him, shadowing him, documenting for him, learning directly from him. And I even followed him to the hospital. We were at Children's Hospital where he had his derm clinic. I was able to see how he worked very efficiently with his residents. And so that training, I believe, was very pivotal in how I practice today. But that moment in time, those several months of training directly with him really paved the way for me and helped mold me into the PA I am today. I was hired in pediatric dermatology. That was what my training was all about, and then it quickly turned into treating the parents of these pediatric patients. So I evolved into doing adult dermatology, and with that came the cosmetic side of it. So I think it was about 3 years, honestly, before I started to get really comfortable in doing cosmetic dermatology. But of course I had that foundation of medical dermatology. I created that relationship with these patients and the parents of these patients, and from there I was able to convert and transition our adult patients into the aesthetics practice that we now have. Everyone wants their skin to be bright, luminous, radiant. Nobody wants to have actinic damage, freckles, melasma, pigmentation, acne scarring. So there's always an opportunity to talk about aesthetics, in my opinion. Of course, there's going to be a portion of the population that don't necessarily make that a priority, but for the most part, and especially in Alamo Heights and in the parts of San Antonio where our practice resides, everyone is going to have questions, and they're going to want to take care of their skin. In fact, that's why they're coming into a dermatology office. So every opportunity with the patient is an opportunity to talk about an aesthetic service. So I do believe that there is a need, and anyone can be successful with talking about products and esthetician services, facials, peels, laser treatments, all of the above.
Some of the things that I like about working here are that we're constantly learning, constantly growing. There's never a dull moment. We're a big, happy family, and of course with that comes a lot. But it's always a blessing just knowing that you have your team to back you up, and that we're always going to be there for each other. So we've been in practice since 2013, so Dr. Browning has a lot of patients that have been with us for that long, so it's good to see them grow. Like, as you open their charts, there's little kids, and now they're teenagers treating their acne, so it's really cool to be able to see them as a kid being treated for eczema, and then also being treated later on as, you know, a teenager for acne, so you get to share that experience with them. You grow with them as well, and you get to learn about their family and things that they've done, and just it's a lot of fun just being able to see them come back to our practice. So one of the great things that we have here is scribes, so I think that's going to be beneficial for our new providers that come on staff, so that they can ensure that they're billing properly and their notes are done in a timely manner. So using the scribes and communicating with them on what you expect in the notes, and then just reviewing that information with them before the end of the day, I think that's going to help a lot with billing effectively and making sure the proper codes are on there.
It comes down to asking questions. When I meet with new providers the first time, I always like to reiterate, please ask questions until all of this makes sense to you. We also have a lot of resources that we provide providers that should make that job a lot easier, especially when you're first onboarding with us. We have chart audits, which are just a full review of visit notes, best practices, and also helps us to identify any coding missed opportunities. We also have a denial review, which is a list of all the most common denials being generated, the how behind those, and any steps we can use to prevent them in the future. We also have a coding analysis that we provide, which is a deep dive into frequencies and trends over the work that's happened over the last 3 months. We have a provider report card, which I'm really excited and is a new tool for us that specifically looks at 6 key metrics that commonly help to maximize providers' efforts in terms of total collections. The last thing I'll say is it's smart to develop a relationship with the billing department. These are experts that use industry-leading technology like the LZ Group, as well as AAPC, and anything else that we can use to help you guys identify anything that's going to make you better at your jobs. That's what we're here to do. We're here to support you and make this whole thing better. So if you're new to San Antonio and looking for an opportunity in dermatology, we'd love to work with you.